This is One-on-One. One of the reasons we do One-on-One is to introduce you to people throughout the tri-state region who are doing important work, making a difference. Let me introduce you to Dr. Bob Jones, who is the president and CEO of Children's Aid and Family Services. Was founded in 1899. 113 years you've been around.
Correct.
You've been there 27 years.
27 years.
And how many leaders has there been?
I'm the fourth in 113 years.
Wow.
We're relatively stable.
I'd say so. I want to thank our friend Elaine Adler and also our friend Don Chalice for introducing us to your organization. Help us understand something. What exactly is the organization as we put up your nonprofit organization's website throughout this segment? Talk about it.
We're best known for working with wounded children who have been traumatized through abuse. We have two major buckets of mission commitment. One is to those children who don't have families that can help them heal from that trauma. We help them heal so we can either get them adopted or into a long-term family if they can't be adopted. And then the other mission bucket, if you will, is it's just hard to get through life. So we have dependent care services such as an early learning center with 250 children. We staff 3 senior centers. We have support programs. We run the Center for Alcohol and Drug Resources in Bergen County that provides education and awareness around substance abuse and adolescent experimentation. So it's really the two ends of the commitment, sort of the Children's Aid and Family Services.
But you also service a significantly large area. I mean, you serve 5 counties?
Yes.
Which ones?
We're everything from Essex, Passaic, Hudson, Bergen, obviously, and a little bit of Morris.
Talk to me about this. In these very difficult economic times, I mean, those of us who are nonprofits, I mean, we run a not-for-profit educational production company. We're out there every day trying to secure underwriters, keep underwriters, find new sources, trying to be more efficient, have people do 8 different jobs. You do the same thing?
Absolutely. And it's probably harder for us because the statistics right now are less than 10% of Americans support charities such as ours.
Say that again?
Less than 10% of Americans support charities such as ours.
Why?
It just doesn't come on their radar screen. But 10% of Bergen County would be 100,000 donors, so I'm not giving up yet. But also, it's our donors, it's a mitzvah. They haven't been touched by us. We're not a hospital that saved their life. We're not their synagogue or their church. We're not their university. So we have to really touch their heart. And what's helpful about even being on with you is to get the word out to people that you can heal these children, make a difference in their life. And it's the journey they go through is amazing, but the outcomes can be wonderful.
Talk about your background. How do you come to this?
My background, I'm a professional social worker. Then I got a PhD in social policy and administration. My whole career has been in child welfare and mental health. Right out of Rutgers, I worked for St. Vincent Services in Brooklyn and did child welfare in Brooklyn. Then spent about 10 years at St. Clair's Mental Health Center up in Denville and have been here for the last 27, and it's what I love. I mean, I'm lucky I get paid to do something that I love.
What do you mean you love? What part of it do you love?
Making a difference for other people, seeing the outcomes. We had an event recently in Jasmine, one of the young people, she's 22, she's going to graduate from college, had a horrible experience, but with the support of the staff.
Excuse me, a horrible experience growing up, I think you mean?
Being abused as a young child. But with the support of the staff and with, we have an educational fund for the kids, we call it a parents fund. She's going to graduate in January, and she's just so happy. And those are very rewarding moments. If you think about what the kids have been through, it's horrifying. But if you think about what they can have, it's wonderful.
You know, I was going to say I hate to do this, but I don't. You use the word abuse.
Mm-hmm.
You say a kid has been through a tough experience. But my sense is that sometimes you have to be more clear and more specific.
Mm-hmm.
Not overly dramatic,
mm-hmm.
but more clear.
Okay.
Talk about it.
Most of our children have been born drug addicted. They have some serious neurological problems often, sometimes worse. So they struggle with that aspect. And many of them have been sexually abused as young children. That kind of abuse was much rarer when I was starting my career. But with the prevalence of cocaine, crack, and hallucinogenics, kids get targeted by predatory males in a way that was unheard of 20, 30 years ago.
What were they facing?
I'm sorry?
What are they facing when they become victims like that at such a young and vulnerable phase of their life? What
Well,
are they usually facing?
when you've been through trauma in a serial way, and you've lived in a situation that is chaotic, unpredictable, exploitive, you almost shut down emotionally. So many of our kids aren't aware of what's going on for themselves, physically or emotionally, and it'll come out in behaviors. And the behaviors are usually ones that are destructive for them or other people. Our challenge is to get them to recognize, to reconnect, if you will, so that they can make a choice about being angry, make a choice about being sad, as opposed to just have it act out in behavior.
Very often, the other piece of this equation for your organization, and again, we're doing this part of the one-on-one initiative. For those of you who watch us every evening on several PBS stations, you know that we do a mini-series within one-on-one called Make a Difference. We are trying to make a difference here. That's why Bob is here. But you can log on to that website, you can make a contribution, you can try to make a difference, but one of the areas that you're making a difference is in foster care.
Right.
Talk about that.
The treatment foster home program that we have takes kids who have been severely traumatized, but they have the ability to tolerate the intimacy of a family. We have a phenomenal track record of the kids actually being adopted by their treatment home parents. And that's a big problem for us because then we lose the home.
Right.
So one of our needs are people who would step forward and learn about the kids. I don't ask people, would you like to be a foster parent? That's like asking on your first date how many children you want to have and where do you
Right.
want to retire. But if they're remotely interested in these kids, volunteer, get involved, become a mentor, become a tutor. And most of the people who ultimately adopt our children never in a million years woke up one morning and said, gee, I'd like to adopt an emotionally struggling youngster, teenager. We're not talking about babies, we're talking about children 10, 11 years old and up, and sometimes teenagers.
What impact can a solid, loving foster family have on some of these children and kids who aren't children, a little older?
In a word, huge. The difference between being in a treatment foster home or, say, a residential setting or
Why are you
group
calling it
home,
a treatment foster home?
because these are kids who have serious emotional problems. We've got psychiatrists involved with all of them. We have social workers involved with them. It's different than a regular foster home, which the state of New Jersey would typically run. As a treatment agency, we don't really receive a referral until a child's failed in 5 to 6 state homes.
Right.
So these kids have trouble with intimacy. They have trouble believing in themselves. They blame themselves often for all those. So the stability of a treatment home, of a foster family, is huge for them. And they work hard at getting rejected, and they tell you many challenges. That commitment, that bond, that claiming process is very healing for them. Also, as they age out into their 20s, there are people who care about them. Many of our kids stay in touch with their foster families.
Dr. Bob Jones, President and CEO of Children's Aid and Family Services. After 27 years, it is clear you've lost none of the passion.
Not at all.
Thank you, Bob.
Thank you. It's good to be here.
Good to have you. Stay tuned, one-on-one. We'll be right back right after this. Thank you.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Robert Wood Johnson Foundation, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. PSE&G, committed to improving New Jersey's economy and strengthening its communities. And by the law firm of Gibbons, P.C. Promotional support provided by NJ Biz, All Business, All New Jersey. And by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.